Welcome and thank you for choosing the Mission Cholesterol Monitoring System. This system measures a complete lipid panel test in as little as 45 seconds. The 3-in-1 lipid panel device tests for total cholesterol, high-density lipoprotein, and triglycerides, while the 3 individual devices test for each of the 3 parameters separately. The Mission Cholesterol Monitoring System also includes calculated low-density lipoprotein, total cholesterol, HDL ratio, and cardiac risk assessment. This monitoring system is suitable for both professional and self-testing. The Mission Cholesterol Monitoring System includes 1 meter, 1 manual, 1 quick reference guide, 2 control devices, 1 control device insert, 5 safety lancets, 1 carrying case, 4 batteries, 1 warranty card. Installing the battery. To start the setup process, you will first need to install the batteries. Turn over the meter to locate the battery cover. Press the battery cover tab and lift the cover to open it. Insert 4 AAA batteries into the battery compartment. Close the battery cover and make sure it snaps shut. The meter will automatically turn on after the batteries are inserted and will enter the time setting state. Press the right or left button to adjust the meter time setting of the year, then press the power button to save. Press right or left to choose the correct month, then press the power button to save. Press right or left to choose the correct date and then press the power button to save. Press right or left to choose the correct hour, press the power button to save, and then proceed to choose the correct minutes. Press the power button to save the setting. After that, the meter turns off automatically. Coding the meter. Each time a new box of test devices is used, the new code chip included in the box must be inserted into the meter. Compare the code number on the code chip from the box with the code number printed on the test device canister or the foil pouch. It is important to do so because results may be inaccurate if the 2 numbers are not identical. Insert the correct code chip into the code chip slot on the left side of the meter. Meter setup before testing. To begin initial setup, after inserting the code chip, press and hold the power button for 4 seconds to turn on the meter and enter the meter setup mode. The test number setup screen will appear first. You can navigate between the different setup sub-modes by pressing right or left. From the test number setup screen, press the power button to select the test number setup in case the user needs to set the test number to a desired number. You can set the test number from 1 to 99 by pressing right or left until the desired number is displayed. Press the power button to save and return to the meter setup screen. Press the right button twice until the system setup screen appears. Press the power button to enter the system setup. First, you will set the units to either milligram per deciliter or millimole per liter by pressing right or left to switch between the 2 settings. Press the power button to save. Next, you will set the clock to either 12 or 24-hour mode. Press right or left to switch between the 2 settings. Press the power button to save and advance to date setup. Choose the desired date setup. Press right or left to switch between the 3 settings. Press the power button to save and advance to the year setup. Select the correct year to be displayed. Press right or left until the correct year is displayed. Press the power button to save and enter the month and date setup. The month and date will appear at the top of the display separated by a single dash with the month flashing. Choose the correct month and day. Press right or left until the correct month is displayed. Press the power button to save. The day will flash. Press right or left until the correct day is displayed. Then press the power button to save and proceed to time setup. The hour and minutes will appear at the top of the display separated by a colon with the hour flashing. Choose the correct time to be displayed. Press right or left until the correct hour is displayed. Press to save and proceed to minutes. The meter will display AM or PM if the 12-hour time setting is chosen. Minutes will flash. Press right or left until the correct minutes are displayed. Press the power button to save and proceed to test number reset setup. Press right or left to turn the test number reset on or off. When the test number reset is turned on, the test number will reset to 1 for each new day of testing. But if the test number reset is turned off, the test number will increase day to day. You may need to set the number to what is needed for each test group. Press the power button to save and proceed to sound setup. Press right or left to select sound either on or off. The sound symbol will appear on the display when the sound is turned on. Press the power button to save and proceed to coronary heart disease setup. Press right or left to set CHD to either on or off. When CHD is set to on, the meter can enter the coronary heart disease risk evaluation. Press the power button to save and proceed to sample type setup. Press right or left to set specimen type to either BL or SE. When specimen type is set to BL, fresh capillary blood, EDTA, or heparinized venous whole blood can be used. When specimen type is set to SE, serum and heparinized plasma can be used. Press the power button to save and return to the setup screen. Press right or left until ELT is displayed on the screen, and press the power button to exit the setup. The initial screen will be displayed. Testing. In this section, we will show the testing procedure in a professional environment. Depending on the test device you are using, there are 2 ways to collect specimen for testing. Specimen collection using a safety lancet for the 3-in-1 lipid panel. For the 3-in-1 test, it is recommended to use the safety lancet to collect 35 microliters of specimen. Massage the hand from the wrist up to the fingertip a few times to encourage blood flow. Clean the testing site by washing your hands with warm, soapy water and then dry them thoroughly. You could also choose to use an alcohol swab instead to clean the testing site and then let it air dry completely before testing. Turn on the meter. To insert a test device, open the canister or tear open the pouch and remove one test device. Firmly insert the test device into the device channel in the same direction as the arrows indicate on the device. Ensure that the test device is inserted all the way to the end of the device channel until the position arrows are parallel with the 2 arrows on the device holder. The blood drop symbol will flash when the meter is ready for the specimen to be applied. Check that the battery symbol is not visible on the screen. If it is visible, your batteries are running low and you can only perform a few measurements, so replace the batteries as soon as possible. Carefully rotate and pull off the protective cap. Hold the lancet firmly against the puncture site. Press the lancet against the puncture site tightly to lance the skin. Gently massage the surrounding area toward the puncture site to collect the required blood volume. Do not excessively squeeze the finger. Wipe away the first drop of blood. Test processing and applying the blood. Apply light pressure to obtain a second drop of blood. Do not apply specimen sample directly on the test device. Collect capillary blood of 35 microliters for the 3-in-1 lipid panel test using a capillary transfer tube or pipette. The capillary transfer tube will fill automatically. It is important to use the capillary transfer tube to collect specimen in order to receive accurate results. Make sure the blood covers the air vent of the tube, or it will be difficult to squeeze the blood out. Never squeeze the capillary transfer tube while sampling. Apply the blood sample to the center region of the specimen application area of the test device. The meter will begin testing automatically with 3 dashes in a line flashing on the display indicating the test is in progress. Results will be displayed in 45 to 120 seconds. Press right or left to view other 3-in-1 test results. The meter will automatically turn off after 5 minutes of inactivity or when the power button is pressed. Specimen collection using a lancing device for the individual tests. For the individual tests, you can choose to use the lancets with the lancing device or the safety lancet to collect 10 microliters of specimen. I will be demonstrating the use of the lancing device for this test. Unscrew the lancing device cover from the body of the lancing device. Insert a sterile lancet into the lancet holder and push it until the lancet comes to a complete stop in the lancet holder. Hold the lancet firmly in the lancet holder and twist the safety tab of the lancet until it loosens. Then, pull the safety tab off of the lancet. Carefully screw the cover back onto the lancing device. Avoid contact with the exposed needle. Make sure the cover is fully seated on the lancing device. Adjust the puncture depth by rotating the lancing device cover. There are a total of 6 puncture depth settings. To reduce discomfort, use the lowest setting that still produces an adequate drop of blood. Use settings 1 and 2 for delicate skin, 3 and 4 for normal skin, or 5 and 6 for calloused or thick skin. Pull the cocking barrel back to set the lancing device. A click may be heard. The device is now loaded and ready to obtain a drop of blood. Massage the hand from the wrist up to the fingertip a few times to encourage blood flow. Clean the testing site by washing your hands with warm soapy water and then dry them thoroughly. You could also choose to use an alcohol swab instead to clean the testing site and then let it air dry completely before testing. Hold the lancing device against the side of the finger with the cover resting on the finger. Push the release button to prick the fingertip. Gently massage from the base of the finger to the tip of the finger to obtain the required blood volume. Do not excessively squeeze the finger. Wipe away the first drop of blood. Test processing and applying the blood. Apply light pressure to obtain a second drop of blood. Do not apply specimen sample directly on the test device. Collect capillary blood of 10 microliters for the individual test device using a capillary transfer tube or pipette. The capillary transfer tube will fill automatically. It is important to use the capillary transfer tube to collect specimen in order to receive accurate results. Make sure the blood covers the air vent of the tube or it will be difficult to squeeze the blood out. Never squeeze the capillary transfer tube while sampling. Apply the blood sample to the center region of the specimen application area of the test device. The meter will begin testing automatically with 3 dashes in a line flashing on the display indicating the test is in progress. Results will be displayed in 45 to 120 seconds. The meter will automatically turn off after 5 minutes of inactivity or when the power button is pressed. Please follow proper precautions and obey all local rules when disposing of blood samples and materials. Professional testing. For professional testing using fresh heparinized or EDTA venous whole blood, serum, and heparinized plasma, mix the specimen well, then collect specimen. 10 microliters for individual test and 35 microliters for 3-in-1 test into a plastic or glass capillary transfer tube or pipette. Apply it to the center region of the specimen application area of the device without touching the test device with the pipette or tube. The specimen must be tested within 8 hours of collection. Allow the specimen to come to operating room temperature for approximately 15 minutes if the specimen has been refrigerated. Anticoagulants other than EDTA and heparin are not recommended. Viewing coronary heart disease, CHD, risk evaluation. This function is for professional use only. It is not for self-testing use. If CHD is set to on during setup, the Mission Cholesterol Monitoring System can evaluate the risk of coronary heart disease in 10 years based on the test results of a 3-in-1 test. In the results screen for LDL, press right to enter the CHD risk evaluation screen. Press the power button to enter the evaluation method. Press right or left to choose between the two methods for the evaluation, FRA and PRO. FRA, or Framingham Heart Study, is popular in the United States and is suitable for both men and women ages 20 to 79 years old. PRO, or ProCare method, is popular in Europe and is suitable for men ages 35 to 65 years old. Press the power button to enter the information needed for the method you choose. If FRA is chosen, you will enter information regarding sex, age, smoker or non-smoker, systolic blood pressure, and blood pressure treatment. If PRO is chosen, you will enter information regarding age, smoker or non-smoker, diabetic, myocardial infarction, and systolic blood pressure. The CHD risk ratio will be displayed on the screen. Press and hold the power button to return to the testing screen. According to the National Cholesterol Education Program, 10-year risk is defined by 3 levels. CHD less than or equal to 10% is low risk. CHD greater than 10% and lower than or equal to 20% is medium risk. CHD greater than 20% is high risk. If your CHD results are higher than 20%, it is advised that you consult your primary physician for further testing and clarification. Viewing stored records. To view stored records, from the initial test screen, press right or left to enter the memory database. To view the individual test results, press right or left to navigate between each record. Then, press the power button to select the desired individual test. Press right to view each result of the chosen record in the date, time sequence. To view the 3-in-1 test results, press the power button to enter the record. Then press right to view each result parameter of the 3-in-1 test, such as total cholesterol, HDL, triglycerides, total cholesterol HDL ratio, LDL, and CHD if the coronary heart disease evaluation has been enabled. If no data is stored, the meter will display 1 dash and MEM. Press and hold the power button to return to the initial screen. Clearing the memory. Extreme caution should be used when clearing the memory. This is not a reversible operation. To delete all data from the meter database, enter the Setup menu. Refer to Meter Setup and Options for more details. Press right or left until DEL is displayed. Press the power button to enable data deletion. MEM will be displayed. Press the power button to delete all the data in memory, then the meter returns to the Setup menu. Press right or left until ELT is displayed and press power button to exit the Setup menu. Press the power button to turn off the meter. Performing an optical system check. The optical system check is performed to ensure that the meter's optical system is functioning properly. To perform an optical system check, press and hold the power button for 4 seconds to enter the setup screen. Press right from the setup screen to select the optical check mode, CHE. Press the power button to enter this mode. The meter will flash the test device symbol. To insert a test device, open the canister and remove one test device. Make sure to recap the canister tightly. Firmly insert the control device into the device channel in the same direction as the arrows indicate on the device. Ensure that the control device is inserted all the way to the end of the device channel until the position arrows are parallel with the 2 arrows on the device holder. Make sure to write down the date on the canister if opened for the first time. Discard after 1 year from the date the canister was first opened. Unopened canisters have a 2-year shelf life. Discard after expiration date. Press the power button to start the optical check. If the meter displays yes, the meter is normal. If the meter displays no, the meter is not functioning properly. Check the control device for contamination or to see if it is damaged. If there are any visible signs of damage or contamination, discard the control device and retest using a new device. Press power button to return to the setup screen or navigate to the ELT screen and press the power button to return to the testing screen. Performing a quality control test. A quality control test is performed to ensure that the test device and the meter are working together properly and that you are performing the test correctly. Control solution tests are performed in a very similar manner to blood tests, using the Mission cholesterol control solutions instead of blood. Each control is available in 2 categories and 2 levels for each category. One category is ready to use for the testing of 3-in-1 test device with 35 microliter drop tip. And another is ready to use for the testing individual test device with 10 microliter drop tip. If the Mission cholesterol monitoring system is working properly, the test value will be within the range of the accepted values printed on the control solution bottle label. First, allow the test device and controls to reach operating temperature prior to testing. Then, mix the control on a mechanical mixer for at least 2 minutes or invert the control bottle 8 to 10 times by hand. Turn on the meter. Check that the code chip number on the LCD screen matches the inserted code chip. Make sure the sample type Displayed on the meter LCD is BL. If not, set the sample type to BL. Refer to the user's manual for details on specimen type setup. Wait for the meter to flash the test device symbol. Insert the test device completely into the test device channel in the same direction as the arrows printed on the test device. While the meter is flashing the blood drop symbol, apply a drop of control solution to the specimen application area of the test device. Use a 35 microliter tip for 3-in-1 test device and 10 microliter tip for individual test device. Refer to the control solution packaging insert for details. 3 dashed lines will appear on the meter to show the test is in progress. Read the results on the screen in 2 minutes. The meter will automatically turn off after 5 minutes of inactivity or when the power button is pressed. Interpreting results. If the result is within the range printed on the Mission Cholesterol Control Solution bottle label, the meter and test device are performing properly. If the test value is outside of the range printed on the Control Solution bottle label, or if the meter is displaying an error message, see the Control Solution package insert for further instructions. Please contact your local distributor for additional information. Maintenance. For best results, the meter should be cleaned after each day of testing. Clean the meter surface with a dry or a damp cotton cloth. Use a dry soft cloth to clean the LCD. Never spray any cleaning solution directly on the meter. Remove the test device holder by pressing in on the middle of the holder and sliding it out from the meter. Wipe it down with a damp cloth or a mild detergent and dry it with a dry soft cloth. Wipe down the meter sensor area with a cotton swab. Make sure you do not scratch the transparent window covering the sensors. Slide the test device holder back into the meter. If the meter is used for self-testing on multiple patients, it should also be disinfected before each test to prevent potential infectious disease transmissions through blood-borne pathogens. For disinfection, please use EPA-registered wipes with active isopropyl alcohol to wipe the meter. Be sure to wet the entire meter surface thoroughly and remove any stains or debris. The meter surface must remain visibly wet for 1 full minute, and then allow the meter to air dry completely before using it again. When the battery icon is flashing, the batteries are low and should be replaced as soon as possible. An E4 error message will appear if the batteries are too low to perform any more tests. The meter will not function until the batteries are replaced. Make sure to turn the meter off before removing the batteries. Troubleshooting. This table displays some of the errors you might encounter and the actions you will need to take in order to solve the problem. Please refer to the user's manual for more detailed instructions. The Mission Cholesterol Monitoring System offers accurate and precise results at your convenience. Please refer to the manual for detailed instructions.